first touch on the roadmap to reopening. Three-quarters of the population expected to be vaccinated by August 9th. That is Singapore's National Day. How much normalcy will we see by then?
2/3, Haslinda, 2/3, not three-quarters. That's the target set.
I stand corrected.
You raised my target, which the Prime Minister set for us. But we are on track. We are on track to achieve that, because as of now, and we are as of beginning of July, 2/3 of our population are already vaccinated with the first dose. So it's a matter of time. So I believe we will reach there by our National Day. 2/3 will be fully vaccinated. That's a significant achievement. And as we approach that, we will have to start thinking of a more definitive roadmap. You see, so far we know where we are heading. The direction is quite clear. We know the milestone, 50%, then 2/3, then 75%, and hopefully higher. We know the steps we need to take. Safe distancing measures, restriction reduce is one thing, but more importantly, travel restrictions, how are we going to open progressively? Health protocols is particularly tricky. How are we going to change the health protocols as we move along this roadmap? So these are the key questions that all our agencies are trying to draw out and draw up as we approach those milestones.
But Minister, why not just adopt what's been adopted by the US, the UK? I mean, they're reopening and masses can gather together, no need for masks, no need for quarantine. Why not the UK-US way?
See, I can't even go to your studio now, right? So I think we will not take the same approach. In Asia and probably Singapore as well, I think the approach has been quite different. We are seeing a few dominant approaches now around the world. One is what you mentioned, US, UK, Big Bang approach, opening up. Congratulations, UK, for entering the finals of Euro 2020, and Wembley will be filled up, I'm sure. And then there is the other approach, which is what China, Australia, New Zealand has done, which is very tight border control, almost an eradication type strategy, but I think they too want to open up. But it's difficult to open up because cases are so low and population is quite naive when it comes to COVID infection. So opening up becomes a problem, a dilemma. But UK and US, when you open up, there's so much uncertainty. You don't know if infections are going to shoot through the roof, and how would that translate into severe illnesses, even deaths. I think what we want is to take a more middle path, get ourselves vaccinated, that's critical, maintain both containment and mitigation measures. They must be, the balance will shift, but you're not going to abandon one or the other. And then open up progressively, package by package, nothing big bang. And each step of the way, make sure we keep populations safe.
Minister, getting to herd immunity is important because that's when those vaccinated and those unvaccinated can then mingle together. When do you see Singapore getting to herd immunity? Could we get there in September, in October? Can it be that conclusive?
I'll give a realistic answer, which many medical experts have advised us as policymakers, that we may not get to herd immunity because the Delta variant is just a lot more contagious. And when you have facing a virus with an R0 of 3, 5, 7, to get herd immunity, you may need 90-95% of your population vaccinated. And we may not get there. Not even a place like Singapore where there's a lot of trust between people and institutions. We may get 80% if we are lucky, which means it's difficult to get to herd immunity, but what we can achieve is to arrive at an endemic situation where you can live with the virus. It's still spreading, hopefully not to too many people, but because of vaccination, very few people fall very sick, which is the case for influenza today. In the US, say a bad year like 2017, 0.67, if I remember the number correctly, 0.67 for every 100,000 persons days, 0.67 are hospitalized, and about 0.2 0.03 resulted in deaths. So if we can achieve this kind of number for COVID because of vaccinations, we will have reached an endemic stage.
We talked about travel bubble with Hong Kong. That's on and off, on and off. Where are we on that? Can the travel bubble be materialize this month, next month? How soon?
We are talking. Our transport minister, Minister Iswaran, is talking to his counterpart. I mentioned before, both Hong Kong and Singapore, we are both in a good position now. Low number of cases, unlinked cases very low. Some days zero, and Hong Kong most days are zero. So I think that gives us the common ground to talk again about restarting the air travel bubble. I try to not call it bubble. It connotes something very fragile and easily burst. I try to describe it as air travel corridor now, but the idea is the same. But I would say we got to go beyond Hong Kong. But
Minister, what is the sticking point?
The sticking point has been we had clusters. We have several clusters. Numbers are up. So it is understandable Hong Kong will not want Singapore-based travelers to go over because we can bring them the infection. But now both sides for a couple of weeks now, for us a couple of weeks, for Hong Kong a few months, have had very low cases. So I think this provides the basis for discussion. But I was saying we got to go beyond Hong Kong. We hope Singapore, Hong Kong can materialize, can become a way forward, a model for reference. But really, we need to open up to more parts of the world.
Minister, is the Sinovac vaccine a hindrance to a travel bubble, even if you don't want to call it a bubble? I mean, Singapore does not recognize those vaccinated with Sinovac in its vaccinated tally, whereas a city like Hong Kong has been pretty reliant on Sinovac. It is one of 2 vaccines approved in the city, along with countries like Indonesia, Malaysia.
Right. Sinovac vaccine records will be uploaded in our national records. And so I think it's more an administrative decision when we can, once it's uploaded, when we can consider including it in our national tally. That is really not the issue when it comes to opening up travel. You see, there are 2 parts of the world now. China, for example, uses Sinovac, Sinopharm, but even before they start vaccination, they are one of the safest places in the world. And so we have opened up unilaterally to allow China-based travelers to come to Singapore without quarantine. So the likes of China, New Zealand, at one point Australia, at one point Taiwan, Vietnam, but now they are no longer. But there is this part of the world where they go for very, very low, almost zero infection. We have opened up to them. We are just waiting when will they be comfortable to reciprocate. And there's the other part of the world, the US, Europe mostly, that have opened up to Singapore. And we are waiting when can we reciprocate, when their numbers go down, when their vaccination rate goes up, and we can reciprocate. So I think it requires two-way reciprocity for air travel to happen again. And I hope that we are not too far from those scenarios materializing.
Minister, Singapore's vaccination rate set to surpass the US and the UK pretty soon, at a time when neighboring countries are still struggling with a pandemic and in need of vaccines. What is Singapore's policy? Is it thinking about helping its neighbors in terms of vaccine supplies?
We'll have to consider all this. As of now, our neighbors are having high infection cases. We are in discussion with them what is the best way to assist, and we'll assist in whichever way we can. Separately, of course, we are participating in COVAX and doing our part. So in the end, there's no doubt about it. To truly recover from COVID, all around the world, different countries must all get a handle on the pandemic. Only then will the world and global economy start to recover through in a sustained way.
Pfizer came out, I think overnight, saying that a booster shot is needed within 12 months. What is your booster strategy?
We are gathering the data. It does look like booster shots will be needed. The question is timing and also what type, because you also need to respond to variants. So this is something that we have a very close working relationship now with Moderna, Pfizer, and other suppliers, and we are in talks with them. And when there's a need, certainly we should have a booster strategy. Having done the first 2 shots in the first round of vaccination, booster strategy will be relatively, I think, smooth in terms of operations. And by then, the population would have gotten used and accepted the idea of vaccinations.
Have you already secured supplies for the booster shots, Minister?
We have secured supply for our vaccination. So there might be capacity for us to use that for some booster shots. But certainly if you have new, especially with the mRNA technology, you can update the vaccine to counter variants. And so this is a space that we are watching closely. And if we need to get into purchase agreement, definitely we'll look into that.